Hello and welcome to the 5th anniversary episode of the Psychedelic Medicine Podcast. I'm Dr. Lynn Marie Morski, and I have been your guide for the past 5 years on this journey. And today I'm going to bring you an update about where you can legally access psychedelic medicines. You may be asking, I've been listening to this show for however many years, and you talk about all the benefits of these different psychedelics, but which ones can I actually access and where? And so today I am going to bring you as much information as I can on these. Now, this is where I will throw in the disclaimer that nothing here on the Psychedelic Medicine Podcast is medical or legal advice. This is just for educational and informational purposes only, but hopefully it will give you a starting point as to where to begin your search. Now, something else before I get started is just that, as always, I throw in a commercial, a little advertisement for the Psychedelic Medicine Association. Since this is the 5th anniversary episode and I rarely come to you by myself, I'm going to also use this episode to do a little bit of behind the scenes about the show. And the first thing is that the Psychedelic Medicine Podcast and the Psychedelic Medicine Association definitely have very similar names, but they are two separate entities. The Psychedelic Medicine Association lets me store the podcast on their website, and I do run both of these things. But since we have no other sponsor, I go ahead and I put a little advertisement at the beginning of each episode, and it goes like this. Are you a clinician, or do you know a clinician who would like to learn more about psychedelics? Please send them over to the Psychedelic Medicine Association website to check us out. Our mission is to educate clinicians on the therapeutic uses of psychedelics so that when patients come asking with questions about psychedelics, which I know they are because I talk to you doctors and nurses out there, you will feel comfortable having those discussions with your patients. And when there is a legal psychedelic accessible, as we will be discussing today, you'll hopefully feel comfortable making that recommendation or referral. You can find out more at psychedelicmedicineassociation.org. Now, one other little behind the scenes is that I asked you all, my lovely followers on Instagram, if you wanted this podcast on YouTube, and overwhelmingly, the majority said yes. And so a few months ago, I put the episodes up on YouTube. I recorded video way back in the day for the first 2 years. Then I didn't record video for a while, and now I'm recording videos again. So you'll see a mix of when you can and cannot see the guests' lovely faces. But from now on, I will be recording video so that those of you who prefer to watch your podcasts can do so over on our YouTube channel. And if you could do me a giant favor that costs you absolutely nothing, if you could please subscribe to that channel, even if you never watch it, it really helps if we have more subscribers that will unlock some capabilities for the channel in the future. Now, without further ado, let's get on to the discussion about where you can access psychedelics. Now, before we get into the legal access, I want to talk a little bit about decriminalization. And just a little bit, first off, the difference between decriminalization and legalization is that decriminalization usually means that law enforcement has decided that prosecuting cases involving drugs or pulling you over for amounts of drugs that are small is like the lowest level priority. Different legislation, different cities have different rules with specifics regarding this, but in general, that's what it means. It does not mean you can sell them. It does not mean you can buy them. It does not mean they are regulated or taxed. All of that is what happens when something is legal. So if you think about cannabis, I live in California, cannabis is legal here. It is taxed a lot. You have regulations involving it. There are no regulations in a decriminalized landscape. So there are ways to access psychedelics in decriminalized areas. Now, if you are going to do so, please check out one of the many episodes that we have done on how to select a facilitator and how to select a retreat center if you happen to be. And we do suggest that you are using one of those for your psychedelics. So again, this is all in the spirit of harm reduction, that if you are doing something that is not legal but is decriminalized and you are going to a retreat center or facility, which again, always best, have guides that are well trained, be in the proper set and setting. But please check out the episodes that we did on how to select a facilitator and a retreat center that are going to be the safest for you. All right, now on to legalization. As you probably know, the state of Oregon legalized an adult use framework for psilocybin. Again, that's magic mushrooms. And the voters voted on that in 2020, and it went online in 2023. So most of the information I'm giving you, I have looked up on the interwebs. I do not know all this stuff off the top of my head. And it's only as current and updated as when I looked it up, which was recently. But as you know, in this landscape, things can change very quickly. I think another city decriminalized just last week. So there's my disclaimer is that if you're listening to this a year from now, please recheck all these sources. But this is August 20th, August 20th that I'm recording this, and 2024. And as of when I looked this up, in Oregon, there were 29 licensed service centers. And just to back up a little bit, to look at the Oregon model, everything is licensed. The facilities are licensed. The facilitators are licensed. The growers are licensed. The people who test what is grown are licensed. The people who are teaching the facilitators, the training programs are also licensed. So there's a lot of oversight. And in that scheme, there are now 29, or I say now, when I look this up, 29 licensed service centers across Oregon. There are 12 manufacturers, 2 testing labs, and more than 300 facilitators. You may be asking who can participate. This is anyone over the age of 21 without a contraindicated condition. Contraindicated means not only like, is this not like, what's the best layman's way to say this? Contraindicated, at least in medicine, means you should not be doing this. We have a reason to think that this is not safe for you. And I'll go into that in just a minute. But just wanted to remind you that in the anyone over 21, you do not have to be an Oregon resident. So a lot of people do travel to Oregon for this. So what is contraindicated for Oregon? They have exclusionary criteria. And those criteria are if they do the questionnaire and they get a positive response to one of the following, whether you've taken lithium in the past 30 days, if you have thoughts or desire to self-harm, or you have a history or the contraindicated condition that they seem most concerned with here is having a history of a diagnosis or treatment of active psychosis. So there are a few other things on this list, but the main one that I want to bring up that somebody would know going into this is whether or not they have a history of a diagnosis or treatment of active psychosis. Now, as far as the cost, this can range between $1,000 to $3,000 and up. So as you may know, with anything that is new and supply and demand is what it is, costs are always very expensive at the outset. And so, and we'll be talking about things that are more expensive than this, but yes, I just want to acknowledge that this price is still probably out of the range of availability for a lot of people. And it's worth checking with the service center if they might have a scholarship program. I think they're supposed to have some kind of program to help people who cannot meet those costs, but it's worth checking out. Now, we're going to move on to Colorado. Colorado has set up something similar, or they are working on setting up something similar with psilocybin that will go live in 2025. So January of 2025, they are going to start accepting applications for facilitator licenses because, again, it will be licensed all over like Oregon is. And so hopefully that will be live sometime, let's say mid to late 2025. We'll have to see how fast that goes. But just know that if you are in the state of Colorado, something akin to the Oregon program is coming to you. Now, if we're moving on from psilocybin, let's talk about MDMA. You have probably heard, if you happen to be an industry insider and paying attention to these things, that there was a new drug application to the FDA, meaning that a company called Lykos Therapeutics, they had done phase 1, 2, and 3 trials with MDMA-assisted therapy for PTSD, and then they filed this new drug application, which is what you file with to the FDA, trying to get something FDA approved. And on August 9th, a couple of weeks ago, the FDA denied that application and they had a response, and there's still back and forth, I think, going on between Lykos and the FDA. I do not have any insider information into that. And moreover, I hope you realize that in this podcast, I don't try to give you a lot of industry insider information because that's not what is useful to somebody who is struggling. If you are out there looking for some kind of treatment for your depression, or PTSD or anxiety or whatever, and you think, can a psychedelic help? I want to bring you that information. It doesn't help you to know, like, oh, this is why the FDA said yes or no, or all those things. Like, you probably just want to know, what can I get safely and legally now? And so that is what I try to focus on. And also, yes, I do bring you a lot of research on things that will hopefully be FDA approved, but that's why we focus mostly on the clinical and not like the business behind. So I don't know the business behind what's going on with the FDA, except for the fact that currently they have said no. And that's really unfortunate for everybody who was hoping to be able to legally access MDMA-assisted therapy soon for PTSD. So again, now MDMA outside of clinical trials, and I guess here's a good place to tell you, look at clinicaltrials.gov if you want to see what psychedelic trials are going on, because you may qualify for one of them. And they are always looking for participants. But without a clinical trial, MDMA is not currently legally available in the US. The FDA said no for now. Now I'm going to go halfway across the world, maybe more, to Australia, where in 2023, Australia allowed psychiatrists to apply for licenses to administer MDMA and psilocybin to patients. Now, I do not know, I looked today, could not find how many patients have gone through this. Again, like it says, it has to be administered by a psychiatrist who has applied for a special license. And the price tag on this is like 5 digits. So it's more expensive than Oregon. A lot of that is because it takes so much psychotherapy, and the psychotherapist hours are pricey. So if you're in Australia, look into that, ask your local psychiatrist. But I just want to let you know that that is an option in Australia. Now, speaking of other countries, let's go to Canada. Canada also has a way to access MDMA. They have something called the Special Access Program. It allows healthcare practitioners to request access to psychedelic substances such as psilocybin and MDMA for their patients in special circumstances. And those circumstances are patients who have serious or life-threatening conditions where conventional treatments have been unsuccessful or are unsuitable. So the way that that works is your practitioner, your healthcare doctor or nurse practitioner, et cetera, must submit an application to Health Canada, provide the details about the patient's condition, the rationale for using the psychedelic, and information about the proposed treatment plan. And then Health Canada reviews each application on a case-by-case basis. So far, this special access program allows access to psilocybin and MDMA for therapeutic use. They said that other psychedelic substances like LSD or ayahuasca may also be considered on a case-by-case basis. So Canada really taking the lead here. Very cool, compassionate things happening up in Canada. Way to go. Now, back to the US, let's talk about what we can access legally. And that throughout the entire country, which is ketamine. Now, we're going to talk about generic ketamine in a minute. And you may say, what's the difference? Well, if you go way back to the first year, 2019, of this podcast, there's an episode on the science of ketamine with Jason Wallach, where he described what ketamine is versus something called Spravato. And I'm not going to get into the chemistry of it. He goes deep into it, but they are enantiomers, I believe. Like, one is the right-hand version and the left-hand version of the ketamine molecule, or one is, I think actually generic is both versions, which is called racemic ketamine. Lots of hardcore nerd stuff. Go listen to that episode. Let him do it justice that I am totally not doing it justice. But the point is, there is generic, old school, basic ketamine that is no longer under a patent, which means it is quite cheap. It's been in use since, I think, the 60s or the 70s, and it was approved as an anesthetic. That's what we're talking about when we talk about ketamine generally. There is a new type of ketamine, which is the left-hand version of the ketamine molecule, and that has been patented by Jensen and is called Spravato. That is, so we either call it S-ketamine or Spravato. Those are the two names. And since it is patented, and since it was FDA approved, for treatment-resistant depression, that means that it has what we call an on-label use. So on-label is, in layman's terms, I believe, and again, forgive me if I'm not 100% correct on any of these, but the way that I understand the definition of on-label as a doctor is what it was FDA approved for. That's the on-label indication. So Spravato was FDA approved for treatment-resistant depression, whereas all the other ketamine that we use It was FDA approved way back in the day as an anesthetic. And so when people use ketamine for treating depression or all the other kinds of things that we've talked about on the podcast, that's what's known as an off-label use. They're using it for something different from the on-label condition. And this is legal. And so there's nothing illegal about this off-label use. Just the issue is it is not generally covered. Insurance generally only covers the on-label uses of medications. So that means that you are more likely to have insurance cover your Spravato, the on-label indication for treatment-resistant depression, than if you had treatment-resistant depression and you were using regular ketamine. So I want to give you some information. This is an article by Vincent Uralaman of the Harvard Petrie Flom Center. Again, because like I said, I had to research all this. This is not just stuff I know off the top of my head. So Spravato requires biweekly infusions, and the total annual cost can be anywhere from $18,000 to $45,000. So, like I said, old school ketamine is very cheap. Spravato is not. The difference is medical insurance does very often cover Spravato. Now, billing your medical insurance, there will be codes both for the actual like drug delivery and the supervision, because with Spravato, you have to stay at your psychiatrist's office for a monitoring period of at least 2 hours. And so, there has to be a charge for that. So Spravato is covered by Medicare Part B, which pays 80% of expenses. And you're like, hold it, why are you getting into the nitty-gritty here? Because I want you to know who, like, as the person sitting here listening to this podcast right now, with the insurance you have, are these things going to be accessible to you? So in addition to Medicare, there's also something called the Spravato With Me initiative, which requires patients to pay only $10 per treatment. And the easiest way to qualify for that is to have insurance that covers Spravato. And many insurers do. It says here in this article, Cigna, Aetna, Blue Cross Blue Shield, United Healthcare, Medicaid, and Medicare all provide coverage. So that is Spravato. So hopefully, if you have any of those insurances, and you're interested, that they will cover it. Again, because just because I'm saying that they are going to cover it, insurance is never a, all or nothing thing, right? Some insurances will say yes, where others say no, depends on who you get that day, who is looking at your case. But just from the article that I have referenced, those insurances are likely to cover Spravato. And again, the program was called the Spravato With Me Initiative. Now, going back to regular ketamine, which, although it is cheap, like we said, you have to pay for those monitoring hours, and you have to pay for the space where the office is, and you have to pay for the person who's there monitoring your blood pressure and doing the administration and all the other staffing costs. So there are a number of costs associated, and especially because ketamine generally comes in a 6-session setup where somebody does 6 sessions over like 3 weeks, and then they may need a booster later. But, so that's 6 sessions that can start adding up. So even though ketamine itself is cheap, the cost can be high, and it's not usually covered by insurance. Now, amazingly, there is an insurance company that started about 5 or 6 years ago, maybe, called Enthea. And they have now 15 companies that have signed up through Enthea to provide their employees access to ketamine-assisted therapy, which is amazing. One of those companies is Dr. Bronner's, the soap company with all the words on the label. You know them, you love them. If you work for Dr. Bronner's, you can access ketamine-assisted therapy as an employee benefit through their Enthea insurance, which is great. Now, I asked the Ketamine Task Force what other insurances have been doing regarding coverage at all for regular ketamine. And they said you can get ketamine treatment through some VAs, which is widely varying. And someone on the Ketamine Task Force also said that most commercial insurers have policies against the use of ketamine for depression, aside from Blue Cross Blue Shield of Massachusetts and Vermont. Some split aspects of the bill. So they may not pay for the actual ketamine itself, but they may pay for the person to be monitoring your blood pressure. This is such nitty-gritty, confusing stuff. So it's worth trying and seeing if you can get pre-approval through your insurance. Because they said, though, even though some people get pre-approval, sometimes afterward, they still refuse to pay. Insurance is a beast that I do not, and nor do I think anybody knows well how to tackle. But just know that there are some places that cover it. So if you think this is absolutely out of my price range, but you have insurance, it may be worth checking with them, but keeping your expectations low. I saw here an article by, this is called the Neuromend Infusion Center, and they put an article up, and in it they referenced factors influencing insurance coverage. So these are several factors that will come into play when determining whether your insurance might cover these ketamine infusions. One is the specific diagnosis for which your ketamine is prescribed. Some insurance plans may cover ketamine infusions for certain conditions, but not for others. Second, the qualifications of the healthcare professionals administering the infusion may influence whether they cover it. Like, is the person a doctor versus a nurse practitioner versus a CRNA? That may be a factor. And then they said another crucial factor is how well your healthcare provider documented things. So if you could work with your healthcare provider and say, please document all these things, hopefully that will help. So that is my little roundup of where we are. Just and there are so many other things in the world, right? Like there's decriminalization in Portugal and I think Uruguay, and places where things are gray area. Like, a lot of people go to Mexico to do ibogaine or to South America to do ayahuasca. So this is by no means a comprehensive view. I wanted to focus mostly on what is legal, because we know that that's the way that things are going to be the most monitored and therefore safely accessible, right? Like if something is legal, that means that there are parameters around its administration and that there are ways, if something goes wrong, that there are repercussions. And that is what keeps people, for better or worse, that is what will keep everybody on their best behavior and following all protocols. And so that's what we like to focus on, is where can we access these things legally and safely. Now, just now that we've wrapped up the how can I legally access psychedelics, and again, let's hope that in 5 more years, this follow-up episode, the 10-year anniversary, is like, hey, we have all these FDA-approved psychedelic options. That is my hope. And if you are one of the people working in the psychedelics industry toward that, if you're a researcher, all of the above, my hat's off to you. Thank you so much for the work that you do. Before I wrap up this episode, just want to, like I said, let you know a few things behind the scenes. For a number of years, this episode, the podcast was just me. And then I think about 2 years in, I brought on Jared Morningstar. He is the one who puts together the show notes and posts things on social media. And without him, I don't know how I would pull this all off. So thank you very much to Jared. I also just wanted to let you know how guests are chosen. As I said before, I want to bring you evidence-based information. And so many people write in and say like, oh, my life was changed via psychedelics. I just want to tell my story on your podcast. Well, if you go to the first 65 episodes, we have patient experiences, but this is just not a trip story podcast, right? I think at this point, we know that there are amazingly powerful medicines in the psychedelic realm. And I did put up one patient experience for each of the most common medicines. So if you go back to that first 65 episodes, that's what I refer to as the Encyclopedia of Medicines, because for each medicine we start with a patient story, a patient experience. Then we have the scientific episode, like I mentioned with ketamine. We go into the science behind each medicine. Then we have an episode on the practitioner methods, like what can you expect the practitioner or facilitator to be doing during that episode. And then we have an episode on the history and legality of that medicine. And so if you want to hear personal trip report stories, go back to those. But please, for everybody else, if you could kindly stop writing into my Instagram. Like I said, it is only me and Jared and only myself who checks this and gets lots of messages. Everybody wants to share their story. I love that. Thank you for supporting the podcast and all that. But we, at this point, are no longer doing patient episodes. What we focus on is clinicians and researchers, because I know you're out there asking, okay, I have this condition, let's say OCD. What is on in the research for whether psilocybin can help OCD, or is it MDMA, or is it ketamine? Like, I want to bring you answers to those questions from the researchers who are doing the research, or from the clinicians that happen to be using these things in the office. A lot of times that's ketamine, because that's what's legal at this point. But that's why we choose who we choose. And so if you are a researcher and you want to come on and share your research, please let me know. Absolutely would love that. Or a clinician who is treating a special population that you think doesn't get enough airtime, and people out there may be wondering about that, then let me know. That's how we choose our guests. And one last thing, as you may notice, since episode 60 or 70 something, we have not had a sponsor. And so this is just a labor of love, but I would not be upset if that labor of love had a sponsor. So if you happen to have a business or know of somebody who has a business where the psychedelically interested may be your target audience, please reach out and let me know. I would very much appreciate that. And last but absolutely not least, I want to thank each and every one of you who tunes in week after week or shares an episode or likes things on social media. As you know by this time, any interaction you have with some content that I have put out in the podcast land or on Instagram is a great way of supporting because it helps amplify the podcast. And so I want to thank you for the years of support, for how many of you have written into the podcast, oh, I love this episode, or I checked out this person's work because I heard them on the podcast, or I ended up working with somebody because I heard about the research and wrote to them, because so many of our guests have been so generous with their emails. They just, hey, if anybody wants to contact me, which is amazing. And I think it speaks to how people are in this industry because they want other people to feel better and they want to help, and they're so generous with their time. And so I also want to thank all of the guests who've come on. Thank you for sharing your time. Thank you for sharing your wisdom. And for everyone else out there, here is to the next 5 years of Psychedelic Medicine podcast episodes. And I can't wait to have you there with us.